Good morning, everyone. I'm Dr. Gutierrez. I'm a research fellow at Cleveland Clinic, Florida, and I will be presenting you the cardiovascular risk reduction after bariatric surgery, especially sleeve gastrectomy. So I want to thank SAGES for having the opportunity of having our research project. And also I would like to thank our mentors, Dr. Rosenthal, Dr. Shamstein, and Dr. Lomenso. So I have nothing to disclose, and I want to start with this quote. This quote was written almost 400 years ago, and it reflects the difference between our natural age and our cardiovascular age. And this difference has increased in recent years because of a disease that we all know that is called obesity. So obesity is an increasing pandemic. You see it everywhere. And it's a disease with a high death toll, 300,000 deaths a year, 117 billion in healthcare costs, and obviously everything is related, or almost everything is related with the cardiovascular disease. So how do we measure cardiovascular disease? Well, we have the Framingham heart study that is the main reference for over 65 years regarding risk factors of cardiovascular disease, and it's a tool that can predict a 10-year cardiovascular risk mortality. And it has been already used in bariatric surgeries and cardiovascular projects, but the problem is that most of these projects are gastric bypass and gastric banding, and little projects regarding sleeve gastrectomies. So our study goal was to determine the impact of bariatric surgery, especially in laparoscopic sleeve gastrectomy, in Framingham, the Framingham 10-year score, and vascular age. So we reviewed more than 1,400 patients, and we included all patients that had 30 to 74 years and without a cardiovascular disease. And we calculated the preoperative, the Framingham score at 3 and 12 months postoperatively. And what we got, more than 350 patients, mean age in their early 50s, preoperative BMI in more than 40s, and systolic blood pressures up in prehypertensive ranges. And as you can see, our population are mostly sleeve gastrectomies. And what about the risk? So as you can see in the lower bar, you can see that the risk, ideal female risk, is the ideal female risk for our population will be a female, 52 years, that was our mean age, without comorbidities and BMI below 25. And you can see our current risk was almost 4 times higher than the normal risk. There was in 3 months a rapid decrease in the risk, and at 12 months a continuous decrease. And regarding males, male always has a baseline risk higher than female. And as you can see, 1 year later, it's slightly increased, obviously. But look at the risk in males, almost 3.5 times higher than the average male. Average male saying BMI 25, 54 years, and without comorbidities. And look, after 3 months, the decrease, statistically significant decrease, and at 12 months, it continues to decrease up to 12 months. So we had a relative risk reduction of 36% in female and 32% in male. And what about the age and the vascular age, comparing both things? As you can see, the real age of our patients was 52 years, obviously 1 year later, 1 year older. And look at the difference between the real age and the vascular age. As you can see here, patients were, their vascular age, female patients, were 17 years older than their real age. And obviously, after 3 months, it has a rapid decrease, and it continues to decrease up to 12 months. And what happened with our males? 54 years median. Look at the vascular age, 73 years, almost 20 years above the mean age. And look at the 3 months, rapid decrease, and at 12 months, it continues to decrease. So female decreases almost more than 7 years of vascular age. Note that the female were 1 year older, and they still decreased 7 years in the vascular age. And males were almost 7.5 years younger, talking about vascular age. So everything Obviously, bariatric surgery influences everything: BMI, systolic blood pressure, diabetes, treatment for hypertension, and tobacco use. And as you can see in the yellow box, everything is statistical significance. So everything is contributing in the decrease in cardiovascular risk and heart age. And what about talking about our two main procedures done widely? Okay, so as you can see, sleeve gastrectomy and Roux and White gastric bypass are equally effective in reducing cardiovascular risk and reducing the heart age. So our conclusion now that bariatric surgery has a positive relationship between, there is a positive relationship between bariatric surgery and cardiovascular risk reduction, and that Roux and White gastric bypass and sleeve gastrectomy are equally effective in reducing the cardiovascular risk and the heart age. And we are working on a couple of prospective studies to better understand these findings. Thank you.
So we'll take any questions from the floor, but one quick question. I just wanted to challenge you a little bit on your final statement about further prospective studies are needed.
Yes.
So why are they needed? Because your results seem fairly obvious, and what kind of prospective studies do you think you need?
They're fairly obvious in the decreasing in cardiovascular and heart age, but everything is not just it's not just BMI and the things that we presented. We are finding that there is a decrease in the cardiovascular risk, also bile acids and other things. So we are working in prospective study to determine if those variables are influencing in decreasing, because it's not only weight loss regarding the cardiovascular risk. Yeah.
Were you surprised that the relationship was conserved between bypass and sleeve?
Well, not really, because both of them, the resolution of comorbidities are in both of them pretty obviously. So we're not surprised about that. Yeah.